This is a TELL is a completely different biology, and you have the malignant clones, the malignant counterparts of lymphocytes in the bone marrow and thymus, and then post-thymic. The post-thymic cells are called the peripheral T cells or the mature T cells, and anything thymic or pre-thymic from the bone marrow is called as lymphoblastic components. It could be a lymphoblastic lymphoma or it could be a leukemia. And those are very hard disease to treat. Many of them relapse, except for the certain subsets of patients that do have the thymic signature, the CD1A, also have the TDT, but also have the CD1A. And those patients do well with chemotherapy regimens, and many times they can be consolidated with an allogeneic transplantation. But many of the other precursor T-cell lymphomas, they don't do as well in terms of chemotherapy, and they all relapse, and the outcomes are very poor. So Dr. Giorgio Ingherami's group from Cornell looked at the survival signals that these cells are getting from the tumor microenvironment. Obviously, these are cells that reside in the blood, bone marrow, and continuously moving flow of cells. So it so happens that the endothelial cells, as the cells traverse the sinusoids and blood vessels, seem to be giving survival signals. And Dr. Ingherami's group has established that the endothelial cells in a setting of malignancy have a different signature altogether, and they call them the tumor-associated endothelial cells. They're called TECs. So in this particular work that is done by Dr. Capelli et al., published in Blood, which we had a chance to review, showed that they are able to nurse these TELL cells and able to provide survival signals, and this cross-reactivity in cross-resistance mechanisms also coexist because of the TECs. And they also did studies by screening a library of compounds and found that when you take certain compounds that is able to bring down the TEC activity, that also brings down the TAL activity. So in other words, what their work is suggesting, at least in the preclinical models and the mouse models, is that if you take the TECs and target the TECs, then you're also able to target the TALL cells. And that's a very interesting finding, and that has a lot of ramifications, because if you think about moving beyond chemotherapy, I think our strategy should be to try and also target the tumor-associated endothelial cells and the specific signatures that they exhibit. So and the TAL at the same time, I think your strategy will be much more successful than trying to do a non-specific chemotherapeutic approach.